Hello everybody, I'm Dr. Rajiv Uttam. I'm the Director and Head of the Department of Pediatrics at Medanta Hospital, Gurugram. Welcome to Fit Tak. Our topic today, we're going to discuss today dehydration in children. Dehydration, as the name suggests, means there is lack of hydration. Hydration means water or fluid in the body. There are different reasons why a child can get dehydrated. If we talk about a small baby or a newborn, if the baby does not get the feed at the right time, it does not get the adequate fluid, the older child can have loose motions or diarrhea. If there are repeated vomitings, these are the common causes for fluid loss or dehydration in children. As a parent, you should know what are the different symptoms and signs in a child who is dehydrated. So dehydration can be of a mild, moderate or a severe kind. Symptoms in the child would be less active, it will be lethargic, his lips will be dry, there will be less urine output, the child will be cranky, could be sleepy, and his skin turgor, or when you pinch the skin does not return to normal soon. So there is a lag which is called turgor of the skin is reduced. His eyes can be sunken. So normally if you see the child and it looks like the child eyes are sunken, his lips and mucous membrane tongues are dry, and he is overall looking lethargic, and there is a reason that he had a loose motion or he is not drinking enough. And some children, like diabetes, type 1 diabetes in children, there is a lot of urine output. The child loses a lot of fluid through the urine. This is called polyuria. The child can be dehydrated because of that. So these are the common symptoms and signs of dehydration in children. In a severe dehydration, if the child, you do not take care of the child at this level, when the child is presenting with these symptoms and child is not given enough fluids, the child can go into severe dehydration. It means the child can be comatose, the child can have seizures, and the child can have other organ dysfunction if you do not give or replenish fluid at the mild dehydration level. Small babies, newborn babies, first time mothers, if you do not have a help at home and you're not given proper instructions, one does not know how frequently to feed the newborn. Does he need feeding every few hours? So if you do not give enough milk intake in a newborn and you are not giving them every 2 to 3 hourly, the baby can get dehydrated. The other susceptible group is toddler, who is having loose motions, who is also vomiting, but you are not given enough ORS or the fluids, and we feel the child is having enough, but actually his output is much more than intake. Children with cerebral palsy or children who cannot say about themselves that they are feeling thirsty and they need some fluids are always at the more vulnerable risk than the other children who can display and talk about their problems. The other thing to take care is that if you have a hot humid weather and the child is sweating a lot, he is playing outside in the sun, they are much more prone to dehydration than the child who is kept inside in a cool environment. So if a child is playing outside, he is sweating, you have to give fluids regularly. It can be just normal water, or you can put some salt and some sugar in it to give him the fluids. So to give fluid at a regular interval for a child who is playing outside, who is sweating, the child who is got loose motions. So every loose motion child passes, sometimes the loose motions are very much high in volume. So you need to give ORS, the fluids, much more frequently. So the one way to know about is that the child who is active, who is not vomiting, is taking oral fluids and is passing a light colored urine. It means by most of the time the hydration is adequate. But if none of this is happening, then it means your child is at risk of dehydration. If we do not take care at this moment, it can get into a severity. To encourage children to drink water, is parents should be drinking water themselves. So if I tell my child that hydration is important, it means I must be following the same rule. So tell a child to carry a water bottle when he is going to outside to play. Tell him to take water regularly in between the play, and if he is feeling lethargic, he is feeling tired, he should come and tell you about the symptoms, and then you should give him to encourage more fluids intake. If you are not able to replenish oral fluids, it means the child is vomiting, he is loose motion is much more, he is passing urine, as in case of diabetes mellitus type 1 in children, you should seek medical attention. The child urine output will be less, he will be lethargic, so the time to act is now. And if you do not take care of who is not taking oral hydration and intravenous hydration is not provided, child can go into multi-organ failure and the other complications can occur.